stacked up ambulances, record-breaking waiting lists, and a workforce struggling to make ends meet. The National Health Service is in crisis, and winter is coming. Across the UK, hospitals are at breaking point.
We see times when we can't actually get any patients through the door at all.
Here at Rotherham, they are running out of beds and the patients keep coming.
Resource is full. I've got red firm going off, so we've got to now make that decision of who do we move out of resource to actually get this poorly patient in. Any other ambulance now coming in is going to start queuing unless we actually get some beds or anybody discharged from the department.
But there is no space. The hospital's wards are already full and nobody can be discharged. Patients are made to wait in corridors.
Hello.
Jane has spent 20 hours on a trolley because there are no beds left and nowhere else to go.
I've been here since yesterday at 3:30.
And are you okay here?
Yeah, I'm putting up with it.
That's just one story of an NHS pushed to the limits. At the other end of the country, Alison has a similarly terrifying story. She was taken by ambulance with chest pains to the Royal Cornwall Hospital in Truro. She waited 3 hours before seeing a doctor.
They took me in on the trolley. They did ECGs and blood tests, then sent me back out to the ambulance.
She was eventually told she hadn't suffered a heart attack, but Alison was still in pain. So out of sheer desperation, she and her husband, who lived just 30 minutes from Truro Hospital, drove 5 hours to London's Charing Cross.
And you were there for how long?
I was there for 9 days in the end.
These stories are being repeated all over the UK because the NHS is on life support. When you make a phone call to 999,
Emergency which service?
an ambulance is meant to arrive within 18 minutes. At the moment, that average wait time is actually 48 minutes, over 2.5 times longer than the target. And for those who make it to A&E, 1 in 12 are having to wait more than 12 hours to reach a hospital bed, even after it's been decided they should be admitted. That number is 6 times higher than just a year ago. If the NHS were a patient, these long waits for ambulances and hospital beds would be clear symptoms of poor health. But the NHS isn't a patient. It's supposed to help them. And in England right now, there are a record 7 million people in the waiting room. More than 4 million of those will have to wait 18 weeks or longer to be treated. And over 400,000 would wait a year or more to get help. That's 1 in 18. The impact of the pandemic has piled pressure on the NHS and added to long waiting lists. But the worrying trends around patient care stretch much further back than COVID. This isn't new. It was happening well before COVID. The winter all year round, the pressures that are unsustainable on the NHS. And the sad thing is, when you talk to the staff and when you talk to patients, they seem to just accept it, that this is the way things are now. Such a poor diagnosis might help to explain why an NHS is having huge problems hiring and keeping staff. Right now, there are 132,000 job vacancies in NHS England, and 1 in 9 health workers left the NHS in 2021 alone.
A lot of people are looking in particular at retirement and maybe taking retirement early because of the stresses.
The pressure is phenomenal and there's not enough pay.
The government has offered the majority of NHS workers a one-off fixed pay increase of £1,400, but because of the state of the UK economy, the pay increase the government is offering means no NHS staff members' pay will rise in line with skyrocketing inflation, which is why nurses have voted to go on strike for the first time ever. Winter is coming, bringing with it more flu and more cases of COVID, piling on the pressure to a system buckling under the strain. Hospitals and staff are already stretched to breaking point, and stories like these will be played out again and again all over the country.